there another pandemic lurking around the corner?
Maybe.
What are the things that you must know about it?
Wait a minute.
Oh, shit.
Hey everyone, welcome back to Teddy's Lab. Today we are diving into the fascinating world of viruses to uncover things you should know about Human Metapneumovirus or hMPV for short.
Who?
So Human Metapneumovirus is a respiratory virus that was first discovered in 2001. Wait. Some of you may say it's a relatively newcomer in the world of infectious disease, but it has been around for much longer, silently affecting people worldwide.
What does that mean?
Scientists have recovered antibody capable of neutralizing this virus from a human sample stored in 1950s. So it has been here for much longer than around 20 years.
What is it?
It's closely related to respiratory syncytial virus or RSV. Primarily targets the respiratory system, causing infections similar to those caused by RSV and influenza. Similar, not the same.
I get it.
Let me get over the nonsense first. So metapneumovirus are enveloped, non-segmented, negative sense, single-stranded RNA viruses. Here is my drawing of the viral structure.
No shit.
Nice.
And it belongs in the realm of Riboviridae, kingdom of Orthorhynaviridae, phylum of Negarenaviricotta, subphylum of Habloviricotina, class of Mongiviridaceae, order of Mononegavirales, family of Pneumoviridae, genus of Metapneumovirus. And there are two species, Metapneumovirus hominis and Metapneumovirus avis. The hominis affects humans, so it's called Human Metapneumovirus. Then the avis affect avians, or it's called avian metapneumovirus.
What?
What are you talking about?
I get to say this every day. Story of my life. So furthermore, the human metapneumovirus have two major genetic lineages, A and B, which are further divided into sublineages or clades, A1, A2, B1, B2. So human metapneumovirus can lead to symptoms ranging from mild cold to severe respiratory illness. Majority of the population will develop mild cold. Well, that is what we know from the previous strains. The current strain could be different. Well, that is something that I learned from the bad bug 4 years ago, COVID-19. So severe illnesses are especially in young children, the elderly, and people with weakened immune system. So how does it spread?
How?
Human metapneumovirus is most likely spread from an infected person to others through secretion from coughing and sneezing, close personal contact such as touching or shaking hands, touching objects or surfaces that have the virus on them, then touching the mouth, nose, or eyes. So avoid doing that. What kind of symptoms will a person show if they develop this viral infections? Symptoms of human metapneumovirus can be quite broad.
Are you kidding me?
They include cough, fever, nasal congestion, sore throat, and wheezing in mild cases. And in severe cases, it can lead to bronchiolitis and pneumonia. And to diagnose it, your physician will do clinical evaluation. They may also do bronchoscopy or X-ray to look for changes in the airway of your lung. And for laboratory diagnosis and confirmation, they have to collect a respiratory sample and do reverse transcriptase PCR to confirm the presence of virus in a respiratory sample. The clinical diagnosis and bronchoscopy and X-ray are not definite diagnosis, so you have to do a PCR diagnosis to confirm the infection. What are the treatment options? Currently, there is no specific antiviral treatment for human metapneumovirus.
No!
The management focuses on relieving symptoms, things like fever reducers. You can use over-the-counter drugs like ibuprofen, paracetamol, or others. Hydration. You have to keep yourself hydrated and take a rest. Plenty of rest. For mild infection, this is enough.
Oh, is that so?
But if it is severe, you need to go to healthcare setting or hospital, and your physician may do oxygen therapy. If you are having a hard time breathing, the physician may give you an extra oxygen through a tube in your nose or mask on your face. They may also give you IV fluids delivered directly to your vein, which may keep you hydrated. And corticosteroid therapies may also reduce inflammation and may ease some of the symptoms. How can I avoid the infection? Well, the preventive mechanisms are fairly similar with COVID-19, so we are used to them because we have been doing them for the past few years. Washing your hands with soap and water. If you aren't able to use soap and water, you can use alcohol-based hand sanitizer. Cover your nose and mouth with your elbow, not your bare hand, when you sneeze and cough. Avoid being around other people when you or they are sick. If you are sick, please stay at home and stop the spread.
Thank you.
Consider wearing a mask if you are sick and can't avoid being around others. So wearing a mask is one good preventive mechanism. Avoid touching your face, eye, nose, and mouth. Well, at least when you are in public places, touching several things around. Don't share food or eating utensils like forks, spoon, cups with others, if that's still a thing. But most people will not do that, so it's not going to be an issue.
I can do that.
Who is at risk of developing severe infection from this virus? If there is a child younger than 5, especially premature infant, or a person who is older than 65, they are at risk of developing severe infection. If a person have weakened immune system from conditions like HIV, cancer, autoimmune disorder, or from medications that suppress your immune system, they are at risk of developing severe infection. If a person have asthma, complicated obstructive pulmonary disease, or other respiratory problems, they are at risk of developing severe infection.
Okay.
If you like the content of this video, please subscribe to the channel and give it a like. And if you want me to do more videos about it, or if you have specific questions, please leave a comment below. And until next time,
Goodbye.